Meth lab.
Oh my God, what were you thinking?
I think anybody who starts a meth lab turns out most crazy.
Although they should make... So the meth lab. Oh, you went to...
Oh yeah.
This one?
Oh, everybody, you have to take off 4 health tokens. I'm so sorry.
Contribute to based on your profession.
And what about based on my disorder?
Well, that looks familiar, right? That's because you just did it. Where are we? We're at ArtCraftTech 09. That's where you are right now. And what are we talking about? Health and wealth. Okay, so why? How did this happen?
Because it seems that the problems that we're having are a matter of how we're thinking about it. Everybody's sort of thinking about healthcare in terms of money. How can we get more money at the problem? And there's something intuitively wrong about that. I think we all feel it.
Healthcare and wealth was a synergy of 2 concerns that were brought up among the core participants, and then the game flowered in a very organic manner during one of our conference calls.
So what are some of the possible professions, disciplines, who could get together? Okay, well, let's start with art, because I understand art. What about you?
I understand art as well, and I'm also interested in craft.
Oh, really? Okay, so art and craft. All right, so but there's something else. I mean, there's another way to look at this.
And you want to get really deep into a problem, you're going to have to get down to the...
Like the technical level, right?
Yeah, the technical details.
Yeah, technical level. Okay, so there you are.
So we have
you have art and you have craft, and there's just one ingredient missing so that we can really make things happen. Right, tech. Okay, there you go. So art, craft, tech. Let's get people who make things and think about solving problems, but aren't necessarily the people you go to solve problems together in one room and see what they come up with. See if they get a sense of something they want to do. But the thing is, it starts with art. It doesn't have to be a scientific process entirely. It can be speculation.
And the beauty of that is that we're trying to think about a problem that the craftsmen and the technicians have been thinking about for a long time. And we're trying to think about other ways of thinking about it. What else can we bring to the problem that hasn't been brought to it? That's why Clorinda asked us, basically, what problem should we solve before presenting the problem? Because she wanted to see what we had an opportunity to bring a different take on too. And so these were our various different interests. Mine was money. Susan was very interested in the single-payer healthcare system. Patrick was interested in solving war. We thought that was a little difficult. So Mark wanted to look at the way that commodities are moved around, which is economy.
I took all those incredible questions that people gave me, and I said, let's see if we can smush them together. And I asked around, and I said, okay, well, I'm going to smush them together, and I'm going to give you 2 questions, and we choose one. So one, we talked about objects in war. And the other, what's that?
How can we reconceptualize the idea of money equals health or vice versa? And isn't this the problem? Money and healthcare just don't get along in a way. The one eats the other.
Yeah. What Abe said is we can make links, right, between the things that people might not make links between necessarily, and we can talk about those links because we're not invested in it as experts, maybe in a way that's useful. So we talk about this link between money and health, but people don't always make that link. They, you know, I don't think that people think, as Mark said, that poverty is a healthcare issue. They don't necessarily do that. What do you think?
Right, people think about healthcare, specifically in the world of healthcare. We just thought that if we started making links, we could expand the matrix of influences to the healthcare problem.
For example, this is a map of poverty in the United States. It's also a map of where chronic disease is in the United States. Huh, isn't that interesting? Right, that's called the poverty divide. It's actually called the topography of poverty.
So then the next question was, you know, if we're trying to take things out of this sort of linear thought process, how do we bring in the world of people as collaborators, you?
First of all, what do we want to ask about? What are we interested in? Well, we're interested in
Coming up with a different way of thinking about distributing goods and services. And we're tentatively calling this the mortality economy.
and what else? I mean, there's the how does that work? What can we do that would make that happen? Well, you know, it's important to be fun. So Carolyn sent around a video of this stairway in that a lot of people have seen. It's in Sweden. Volkswagen sponsored it, and it's a fun way to think about
Staying
health.
healthy, both physically and mentally, should be fun.
Well, I guess that's what the die is imposing, right? Or implying that, you know, you just can't predict those world disasters or positive events either. So we'll let fate decide.
Hopefully somewhere along the line you trick them into thinking about stuff. It's insidious, tricky, it's trickery in its purest form.
It became a game. Patrick said one thing, you said game theory, I said immersive, and bam, it just snowballed from there. How can we change the equation of money equals health and health equals money? And then we wanted to bring in the public as research partners. And so Patrick devised a huge game.
So the question is, what do we want people to gain or walk away from this with? And obviously it's not a package solutions. We don't have it. What we do have is an idea about expanding the question, engaging different economies, and having people play with them in such a way that the thoughts are out there, right? So we have the capitalist economy, a competitive, zero-sum financial exchange system, and we interrupt it. So we start to think of, like, what's the value of a hub? How good is that for our lives? Right? And we start to think about wealth and health as functions of our social system.